Uncle Argyle telling William Wallace, first I will teach you to use this, then I will teach you to use this. My fellow South Carolinians, use this by using this. And then the second thing I ask you to do, we're in uncertain times. We're in uncertain times. I've never heard of times like these. So I ask you to turn down the volume so we can listen to that still, small voice. Thank you.
Thanks, Senator. Speaker Lucas.
Thank you, Governor, for letting me speak at this very important conference, and I want to thank all the members of the media for coming out and covering this today. When I thought about this issue, I wanted to think about it a little differently than others might have. So I wanted to go back and look at 1917 and 1918 and what happened during the influenza outbreak and how schools dealt with that issue. So I went on the computer and I pulled up various articles, and depending on if it was a left-leaning publication or a right-leaning publication, they'd give you a different answer. If it was a left-leaning publication, nobody went to school back in 1918, 1919. If it was a right-leaning publication, everybody went to school back in 1918 and 1919. So I learned pretty quickly that current articles be very helpful because children going back to school was being made into a political partisan issue, and I can tell you that it's not a partisan issue, it's a personal issue, and it's a personal issue for all of us. On the way down this morning, I've got a number of members, a number of people in my community, but members who are so engaged with this issue who tell me that on one end that their children aren't learning virtually, they're falling behind, but on the other end, Speaker, I've got 5 children at home. I don't like virtual schooling, but I don't know if it's safe to send my kids back. And I certainly understand that. I understand all of those concerns. When people ask me if person schooling is safe during the coronavirus, I ask the same question each time, that if Will, my only son, were school age, would I let him go back this fall, given the numbers that I saw yesterday? And the answer is I would, certainly. And there's a reason for that, and it's not that I'm Republican or Democrat. I am a Republican, but you know, it's based on my personal history. I always like to talk about my dad. My dad was the greatest person I ever knew. He came up poor. His mother and father, I don't think, had 8 years of education between them. It was very hard on my dad while he was at home because my grandfather was always pushing him to leave school and go work in the textile mill. My Uncle Jerry, who was the youngest, always said it was hardest on Dad because he was the oldest and they would push him the hardest to go. Well, he loved going to school. He loved going to Hartsville High School, so he went. And he went every day and he stayed as long as he could because that school offered him such tremendous support. His teachers still would talk about until he died, were so essential in his life. And I can only imagine if my dad's schooling was cut short, that he would have ended up in the textile mill if he'd had to go through a pandemic and not be able to go to school. My dad's story has a great ending. He finished high school. He didn't learn a whole lot. He went to Korea. He fought for 2 years. He went to college on the GI Bill. He went to the University of South Carolina. And on August 11, 1957, he got 2 things, a diploma, and he got me on the same day, which I want to integrate my dad into what I'm going to talk about. And I'm not going to talk long, but, you know, I also think about my son. When you talk about personal decision, I remember in the 2nd grade, his teacher calling me and you'd say, you know, something's wrong with Will. We don't know what's wrong with him, but something's wrong with him. So we took him to Joel Sussman, who was a great psychologist over in Columbia, and he worked with him and looked at him, and you know, maybe he's got attention deficit disorder. He had something called DAMP, which he had attention deficit disorder, but he also had a motor function problem. He didn't have any balance. He couldn't ride a bicycle. He couldn't have his fingers do that. So with the help of some really dedicated teachers who not only work with him during the day, but work with him all of his life after school, tutoring. You know, he graduated Hartsville High School, just like his granddad, just like his dad. He went on to degree in mathematics and a master's degree in analytics, and we're really proud of Will. But, you know, I come at this issue from those two stories. And I think about, when I think about disadvantaged students, I have to think about my dad, who was severely disadvantaged. And disadvantaged today is not having a computer, and it's not having access to the internet. And that's pretty tough. But back then, and also today, disadvantaged is loss of vital services, not having a meal. And I know my dad went to school a lot of times without any money, and he bummed money to get a meal. Loss of safe surroundings, but more importantly, loss of support. When our children don't go.
Welcome back, everyone, here to Fox 10 Extra News Now and coronavirusnow.com. Joint Base Andrews right here as we are awaiting President Trump. Force One takeoff just moments away. We'll try to get that for you, but it doesn't look like there is available. So right now we're taking a live look at the White House. Let's go right now as we get going here. Back out to Illinois. Live news conferences continue.
Transmission that can take place if bars are overcrowded. And often, even though there's been a capacity limit of 25% put on bars, they are not following rules in many cases, and there's transmission. That's one example. Another example is youth sports. You know, we've seen this summer just some examples I talked about. And so those are among the menu of items you heard me talk about. But let's not focus on the 8% fail-safe number. This could happen much before that. In other words, the menu of items that are mitigations are about the numbers moving the wrong direction in a sustained period of time. It could be that a region is moving very quickly upward, but doesn't reach 8%, but over a sustained period, and the 7-day average positivity is moving up. That is a trigger, along with the availability of hospital beds or the increase in hospitalizations. So those are, I mean, I know it's complex, but we want to be very transparent about what the triggers are, what we're looking at. You know, I've said to you all every day, I wake up and look at these numbers on a daily basis. I look at the rolling averages of these numbers, and so does Dr. Ezike, and we're constantly evaluating and making decisions about what is it that we may. Long before we ever get to those points, as you heard, I call local officials, or Dr. Ezike speaks to the local health department to say, there is a problem in your county. What are we doing? How can we be of help to you? What are you doing about it? Local governments have the ability more immediately to do things than state government does. And so we encourage that. But where state government needs to step in, we do and we will. It's an excellent question. You are right on. We ask that question of ourselves because when you look at areas like St. Clair County and Madison County, right across the river from St. Louis, Missouri has I forget the exact number from Missouri, but I think it's around a 7 positivity rate. Ours is 3. So if you live in that area and you're traveling across the bridge to Missouri, you're essentially doubling the possibility that you will, could contract this, or at least the number of people that you end up in front of. It's very important for people who live in those areas to be aware of following mitigations that we've suggested in Illinois, and making sure you maintain your distance, wear your face covering, even if it isn't required in the state that you're going into. That you want to protect yourself, certainly. You hope that people there will be protecting you. But so we worry about the border areas and people who come over the border. Some people live in Illinois and work in a state that's bordering Illinois, and they every day back and forth. And that doesn't mean that they're in any greater danger as long as they're maintaining distance, wearing a face covering, washing their hands, following the mitigations. So that's one thing. To what degree is this about complacency and people just deciding that, I'm done with this? Look, we worry about that, of course. And I think you see that there are young people. I don't know whether they were following mitigations earlier, but you often see young people going to bars or just, gatherings, having parties with one another, not thinking that either that they're vulnerable or that they could be carrying it to someone who is vulnerable. So we worry greatly about that. Social media, it's why we've done outreach to organizations all across the state to make sure that people are paying attention. And then I can't help to mention that there are people who view this as political, that wearing a mask is, and keeping your neighbors safe, political. It's not political. This is just about caring about your community and about people you love.
To follow up on the young people, and this might be better for Dr. Ezike.
Sure.
The statistics that the city released today show that by far the largest group of new cases were from the 18 to 29-year-olds, 30%. Can you tell us statewide, are you seeing similar things, and how does that age group compare with previous data?
Right. So I will say that we've made tremendous with our long-term care residents, which are obviously a much older population. And so that used to be a very significant driver. But in the recent weeks, we have seen that the 20 to 29, and again, we have so much data, and when you break it out, it might be the case for, I think, non-Hispanic whites, 20 to 29, that's the largest group. Then you also had that in blacks, 20 to 29. But then you've never seen this high rate for the 10 to 19. That is new in terms of the numbers climbing over time. They're now at the highest rate that they've ever had from the beginning of this pandemic. So.
What is that rate?
I can't remember all these numbers off the top of my head, I'm sorry, but I can make sure that they get that to you. But as we follow over time and as we follow the total people who are being infected, who are now being infected, we are just seeing that there's a new shift in where the burden is lying, and that's why we're trying to elevate that. And we have a youth forum that we're working to try to solicit input from young people, because we need to understand what they need to have to make the best decisions. Is it that they don't understand that they can infect and go on to infect others? Do they really think that they can't get sick? Because we do have many examples of young people without comorbid conditions. Do they understand that if they are infected and have a history of smoking or vaping, that could portend a much more serious? So we want to make sure that the young people actually have the information. Maybe it got when we talked about elderly people in the nursing homes and they thought maybe they were somehow immune. So we want to correct the narrative if it was misunderstood and make sure we get them the right information.
I don't mean to hog here, but just 10 to 19 would suggest, even though a lot of focus has been on bars, that would suggest an age group that, of course, can't be in bars. So where is the source of this?
So that group, I have teenagers, right? They've been on lockdown, but they are complaining that their friends are out and about. And so kids are congregating.
Or social action?
Yeah, social actions, social gatherings, home get-togethers, trips that are not sports, that are not involving masking and distancing.
So how does that portend for schools?
Well, we know that if schools are to happen, there has to be masking and distancing. But to get there, we have to not have wide community transmission at rates that are not sustainable to even safely do school. That's why our actions today, right now, will determine the gains that we have achieved. We can't rest on them, but we need to aggressively and fiercely protect it. And that will involve universal masking and distancing. Thank you.
Can we talk about the new health regions?
Yeah, sure.
Because I think that's important today.
Sure.
Probably folks are going to be in the Collier County say, great, we're no longer part of Chicago, or we're no longer part of Cook County. But I'm just wondering down the road, if you do have to go backwards, are you also then saying, folks from Chicago might travel to these other counties because you can't dine out in the city? Should that happen? I'm just hypothetically. Are you also creating perhaps some confusion statewide by adding more health regions?
Here's what I would tell you. People have been traveling between these counties, and we talked about Kendall and Grundy. There are people who live in Kendall and Grundy who travel to collar counties, and just like we were talking about people who travel over the border to go to Iowa or to Missouri or to Indiana. So there's a degree of personal responsibility people are just going to have to adopt. We're setting these ones because we need to be able to monitor properly where there are outbreaks, where there are communities that are in danger, and to make sure that we've got hospital beds and healthcare availability for an outbreak that might take place. So, look, we're not going to stop people from traveling between one county and another county, nor do I like the idea of stopping people from crossing the border to another state. I think people need to be aware, and that's one of the reasons that I have press conferences and have been very transparent about this. I want people to be aware that Illinois has around a 3 average positivity rate. Every state around us has double that or more. One of those states has a 9% positivity rate. So just know that when you go into an area that you need to take extra precautions, recognizing that we have real gains here that haven't been realized in other places.
Governor, we haven't been able to talk to you since the new IDES phone system rolled out. We talked to a number of people that have been tracking them, that on the first couple of days they were told they would get a call back 2 to 3 minutes. It's now been a week or 8 days. Can you talk a little bit about the state's accountability as it pertains to rolling out a system that's supposed to save people time?
Yeah.
And they're not getting any call.
Well, let me start with this has been an enormous challenge. I think you're aware of that. And I have made myself available for questions, by the way. You have been able to, yesterday I was in front of the press, and I've been in front of the press quite a lot. But, so I'm happy to answer your questions. This is an enormous challenge. IDES, was overwhelmed. There's just no doubt about it. And I've talked about some of the reasons for that, but that's less important than, how can we overcome the challenges. We have more than 500 additional people answering phones. That's in addition to the people who were already working at IDES that were in charge of answering phones to begin with. And we've moved people from back of the house to sort of front of the house to answer phones. Phones are absolutely, in this ridiculously enormous wave of filings, and don't forget, people have to refile every week. You have to recheck in every week. And to the extent that people are using the phone to do that, or to any way to avoid being online, I would say if you can go online, if you can work online to get your filing in to re-verify, for example, or just to file originally, that is absolutely the best way to do it. Not 100% of people are successful at doing that, but quite a lot, because we see the numbers, and literally hundreds of thousands of people, much easier for them to have done that online. As to the calls, and again, this is where, no doubt about it, this is where the big challenge has been. I want to solve this as much as anybody. The challenge has been, even with additional people answering phones, that in order for them to deal with your specific case, they have to meet a federal requirement that is about 10 months of training. We haven't even been in this pandemic for, more than 5 months. And having said that, we've tried to take any call that doesn't require that federal level of expertise and move that in a different category and try to get people there. You're asking about callback systems. It's a new callback system. When you talk about, maybe 8 days instead of a few minutes, remember that at the very beginning here, it's very difficult to get, a call in. There's no doubt we have a lot of progress that needs to be made. It's one of the reasons why we reached out and got somebody who's been working employment security for a lot of her career to come in and be the director of IDES. She's already providing great ideas for us. One last thing, and you may have seen this in a Washington Post article just a couple days ago. Many states are plagued with the challenges in their employment security department in unemployment claims. I just heard from a senator about a meeting that the Secretary of Labor had at the very beginning, letting everybody know that most state systems are not capable of handling what's probably coming. And so this challenge has been, vexing. That's the best I can say about it. And so we've thrown everything that we can think of to throw out. We've gone to outside providers, we've hired more people, we've moved people from the back of the house to the front of the house. It's not that we do it, that we take the applications over the phone less efficiently. There's only a way to do those. It's just that the numbers that come in every day and every week, I mean, we're talking about hundreds of thousands of calls, and it's just, if you think about the amount of time it takes to take an application or even to just answer a series of questions and how many you could do in a single day, if you were working at IDES, it would be impossible to have enough people to be able to answer every call as it comes in.
Governor,
yes, sir.
Sales are soaring, but the social equity applicants are delayed. How much longer until the Department of Agriculture is finished and ready to award those licenses?
So I let me be clear, coronavirus interrupted. There's a set plan, as you know, in the law that said that we would be able to do this May 1. Well, we know what happened between January and May 1, coronavirus. And the result of that has been a massive interruption of what we intend to have happen here. Now, no new licenses are given until these social equity licenses are given. So, we want to make sure that we're getting accomplished as fast as possible. People of color having the opportunity to enter this industry, to own and to work in the industry. We believe that over the next 6 weeks, that those licenses, I might say, by the way, that if I'm wrong, I'm a week here or there, but that we believe that there will be movement on this over those weeks. But it's an absolute goal of ours. We see the opportunity. This industry, remember, there's an opportunity for 500 licenses in total based on the legislation. About 55 of them were granted, before, and now there'll be 75 that will be granted to retailers, and then the numbers of people who will be transporters and cultivators and craft growers and so on. So I'm looking to finally getting past that milestone.
Can I just ask you one from my colleague at Nexstar, Mark Maxwell? There's still people in the state that believe the Clay County Court ruling major executives issued after April 8th null and void. Do you still believe you have the legal authority to issue coronavirus-related executive orders? Because until another court actually issues a ruling, how can you pretend that this ruling doesn't exist?
Multiple courts have issued rulings. This applied to one person, this ruling that has taken place. By the way, it hasn't even been entered as a final order because the judge held on one of the three items he needed to rule on and then went on vacation. So I know that there may be a ruling in the next few days, but suffice to say that even with the final ruling, it only applies to the one plaintiff that was represented there.
So it's your contention you have the authority, you can issue these rulings?
Yes.
Can you talk about the $52 million that has been collected in the weed tax so far? Is that what you expected, and where that money's going?
I looked back just this morning, actually, because I think that it's nearly double what was projected. The amount of revenue coming to the state was nearly double what was projected. So very pleased about that. As you know, much of that revenue is focused on social equity, on racial equity, through the R3 program, which is overseen by the Lieutenant Governor and a committee that includes legislators and others. And of course, police are supported by some of that money, mental health. And then about 45% of it goes essentially to GRF and bill payment for the state. So this is obviously in a moment when revenues have fallen off a cliff in so many other areas because of coronavirus. It's badly needed, and we're glad to see that there's real success in a new industry that we help to create.
Governor, the president today said that next week he plans to announce unspecified federal action to quell violence in cities, including citing Seattle, Minneapolis, and Chicago, once again comparing Chicago to a war zone and saying that they're run by liberal left-wing Democrats. Obviously, we don't know what action he's going to take, but I'm wondering about your thought of federal intervention.
Well, it's a sign of desperation by the president to try to, improve his own standing somehow, making these declarations. Look, if he really wants to help, we have violence prevention programs that funding. We have programs that are intended to provide mental health, that are intended to help kids get jobs during the summer, that are funded by federal dollars. We would love to get that kind of help. I fear that the president is really thinking about other things and not thinking about what really would help.
Other things?
In Washington, D.C., he brought out the National Guard when there was a peaceful protest. It's, irrational to me. He's acted irrationally all along, so I can't imagine, frankly, on a day-to-day basis, everything seems irrational to me. This gentleman over here, I'm going to go to one last question because he didn't get a chance to ask one. Yes, sir.
Thanks, Governor. Sort of on that idea, the president also, apparently the White House is now the direct line for hospital transmission data. Instead of it going from hospitals to the CDC, it's going straight to the White House. Obviously, that is, many people are saying that's reducing accountability. You've got Dr. Z here, who's part of your team. What do you make of that development at that level?
Well, I'll speak from my perspective. Perhaps Dr. Ezike could speak about what the effect on, our reliance on CDC. The president has tried to politicize every aspect of this pandemic. This should not be political. This is about saving lives. CDC is something that public health departments all across rely upon. They've been a trusted source of information, advice, help. And to go politicize it by interrupting the flow of data, I don't know what is the purpose of interrupting the flow of the data to CDC. The data really belongs and where the experts really are. It can only be political. And it concerns me greatly because I'm focused on the health and safety of our people in Illinois, the best advice that we can get. I reach out to epidemiologists. We have some of the best in the world in Illinois, thank goodness. But I also talk to Dr. Fauci and others to get the right kind of advice to keep people healthy and safe. But CDC is one of those places you want to rely upon. And then when you see a president politicizing, interrupting data, intervening, it gives one pause. But perhaps Dr. Ezike has a different perspective.
Definitely not a different perspective. CDC is our foundational public health entity, not just in this country, but serves as a leader throughout the world. I'm on the call with representatives from the CDC on a regular basis. Dr. Redfield has reached out to me, has taken my calls consistently. We've had dozens of people come from the CDC to help us right here in Illinois to support us with this effort. We send our data, our hospital admissions data, directly through syndromic surveillance, to the CDC. And just last week, I had a call with people who are looking at that data and telling us other ways that we can look at the data so that we can make sure we have additional clues to identify, outbreaks or anything that may escape detection. I would be very concerned and fearful to move into a new situation where the CDC does not have that ability to intervene and support the states as it has been. We also want to make sure that we have data that we can trust and that we can use to make sound decisions going forward. And there's never been a question of that when we share all that information with our public health foundational champion, which is the CDC. So we will continue at the state level, and all of our, I'm sure all state departments will continue to work so closely with CDC. And we are hoping that we will come to a point where we're all working together for the same goal of trying to achieve the health and safety of the people of this country.
So, but can you trust that CDC information now, if it's being routed through the White House?
So I can't speculate on what is going to happen. I just know that we've had a great relationship with the CDC. Our trust
Welcome back, everyone, worldwide. And in news now, Fox 10 Extra, coronavirusnow.com, taking a look at the Dow here, continuing to have a great day, up 185 points there in the green. We'll continue to follow it for you right here. We roll on right now. I'm your host, Mike Pace. Thanks so much for joining us here today. Let's go out to our sister station, Fox 2 in Detroit, with this COVID-19 related stories involving face masks.
Governor, when you take a look at the upward trajectory, are you leaning more to phase 5 of reopening, or are you leaning more because of the numbers backwards towards phase 3?
Well, I can tell you on Memorial Day, Michigan was one of 2 states in the nation that was on to contain COVID-19. The aggressive actions that we took paid off. The people of the state seriously and did the right thing. And because of that, we were like one of only 2 states that was colored in on the national map. Now, if you look and see kind of the rolling averages, 7-day rolling averages, you know that we are in red, just like a lot of other states. We're not in the darkest red like Arizona and Texas, but it's concerning. And so if this trend continues, then it's likely we might have to roll back. And that's what I'm trying to avoid. I don't want to go back. I don't think any of us does.
And Governor, talk about this new executive order when it comes to masking inside of public places. What does it mean?
It means think about the usual rules of no shirt, no shoes, no service. Now it's no shirt, no shoes, no mask, no service. It's really that simple. Simply by wearing a face cover, we can drop the likelihood of COVID spread into negligible numbers if everyone's wearing a mask. 2 people who are masked, if one is sick, it's very, very low likely that the other is going to get COVID-19. But if only one of them has a mask, even if it's the COVID patient, the other one can still inhale droplets from a cough that might seep out the side of a mask. They're both masked, they're a lot safer, and that's why every one of us has to act as though we are carrying COVID, that we're thinking of others, we're thinking about ourselves, and we're thinking about the people we live with, our loved ones.
I saw President Trump wore a mask when he was visiting Walter Reed. Talk a little bit about that. Were you encouraged by seeing?
I was very pleased to see it. I've been asking the White House, encouraging them to really maybe perhaps even adopt a federal mask order. I think that would be a really smart thing, but they haven't embraced that yet. But the fact that the president was donning a mask when he was at Walter Reed, I think was incredibly important. I went out of my way last week to acknowledge people like Dick Cheney and Mike Pence and Mitt Romney for wearing a mask, because we got to take the politics. This is about our health. It's about our safety. It's about getting our kids back in school, and it's about ending the economic pain that we've already suffered.
Governor Gretchen Whitmer, thanks for your time today.
Saline, Michigan is a quiet town in Washtenaw County, and that's the way the people who live here like it. But now Saline is in the news. A number of cases of COVID-19, all connected to a house party over the 4th of July weekend.
The Washtenaw County Health Department, 3 new cases, the majority of them connected to a large house party in early July in the Saline area. Young people between the ages of 15 to 25 have tested positive for the virus.
I would expect that to happen if somebody got together like that. They're careful, and they really ought to be.
Fear is a powerful thing, so, it scares everyone.
As every region in the state is seeing an uptick in COVID-19 cases and a statewide mask mandate now in effect, Governor Gretchen Whitmer weighing in on the dozens of cases connected to the house party in Washtenaw County.
There are so many potential interactions that could have happened with each of those days from the party to when they got tested and got their positive result. That's how COVID-19 spreads.
Large groups of people in enclosed indoor settings is considered much higher risk compared to being outside and being able to practice social distancing.
And that's why we stay away from everybody.
In the early days of the global pandemic,
both my wife and daughter had it. My wife, she ended up, she was sick. My daughter, she showed no signs. So there's 2 people in my house that had it.
Despite having 2 immediate family members who contracted the virus.
Would you feel comfortable going to a party of 100 people?
Yeah, I would. Would I wear a mask? Probably not.
In Saline, Camila Mary, Fox 2 News.
We are in Macomb County today talking to Sheriff Anthony Wickersham about the new rule that went into effect here in the state of Michigan regarding wearing a face mask. As we all know, the governor signed an executive order last week making it a mandate for all Michiganders to wear a face mask inside all indoor public places. That includes restaurants, malls, barbershops, boutiques, hair salons. All of the above, you are now required to wear a face mask when you walk inside those indoor public places. We spoke to Anthony Wickersham, who has made a statement, but he's also providing more clarification. He is not necessarily saying he will ignore this new. What he is saying is he cannot respond to every single phone call his department may get going forward of someone not wearing a face mask at an indoor public place. What he is saying is if a situation gets out of hand, that's when he steps in. Here's more from the sheriff.
The business tells an individual that they can't come in, or they have to wear the mask, and they refuse either to wear the mask or refuse to leave the store. Instead of getting a confrontation, that's where we said we would respond, and then we would take enforcement action to help up the local business to make sure there isn't any problems in those stores.
With that being said, there is something you can do if you're at a restaurant, at a barbershop, any kind of business, and you spot someone inside the establishment not wearing a face mask and is being allowed. You can call this number, 888-535-6316. That will get you to the governor's office and Michigan State Police. Therefore, you can make an official complaint in a very safe way without having to approach anyone about not wearing a face mask. In Macomb County, Josh Landon, Fox 2 News.
Detroit is a national model for having dealt with COVID-19.
Mayor Mike Duggan says the proof is numbers.
We were losing upwards of 250 people a week. This last 7 days, the first 7 days of July, we had one death in this city.
But after moving forward in this fight against a deadly virus, Mayor Duggan does not want Detroit to take steps backwards.
We're starting to see some early signs of trends that are concerning. You go back a few weeks, we were basically seeing about 10 new cases a day. The last week or so, it's been 20 or 30.
Mayor Duggan says the number of COVID cases are higher in the suburbs and other parts of the state. That's why he wants Detroiters to understand the solution to getting back on track is simple.
80% of this is wear a mask.
It was wearing a mask and proper social distancing that let Detroit take the lead in the fight against COVID-19. And the mayor wants to keep this position so Detroit can get to business.
I have been arguing for a while to the governor that I believe that the city of Detroit is acting responsibly, and we need to keep reopening the economy.
And to help small businesses in the city get back on their feet, economic relief is available.
Next week, Detroit small businesses are going to have another $7.25 million available in grants from the state of Michigan, the governor and the state legislature.
To learn how to apply, go to fox2detroit.com. In Southfield, Ingrid Kelly, Fox 2 News.
I think it's going a little too far.
Whitmer announced the news on Friday. Effective today, everyone in Michigan is required to wear a mask in every enclosed space. You must also wear them in any outdoor setting where social distancing is not feasible, all because of the COVID-19 pandemic.
Actually, it doesn't bother me. I'm a nurse, so I wear them 12 to 16 hours a day, so it's kind of second nature to me at this point.
For me, it's a pain in the butt because I do wear hearing aids and they tangle up in my hearing aids. So it's a pain for me.
Rich says it's also hard for him to understand what people are saying when they're talking because he can't see their mouths.
I think it's ridiculous. I think it's unconstitutional. I don't think she has the authority to do it, and I'm not in favor of it.
But the governor says her executive order is based on science, a preventative measure to slow the spread of COVID-19. Every region in the state has been seeing an uptick in cases. And after months of strongly recommending people mask up, Whitmer now leaving nothing up to question about where the state stands on face masks. Those who violate the order are subject to a $500 fine, and businesses can now refuse entry or service to people who refuse to put on a mask.
I've seen way too many people in stores without a mask that aren't social distancing, and I'm 65, and I've got 10 grandchildren, and I don't want to leave them without a grandma. But today, I have not seen one person without a mask inside.
Margot and Jim have been wearing homemade masks for months, and they're having fun with it.
That's one of his old shirts that he loves, and I want one out of this shirt.
In Saline, Camille Amiri, Fox 2 News.
We are near the corner of 9 Mile and Woodward in the city of Ferndale, a very popular location where you have businesses side by side. And here in the city of Ferndale and elsewhere in the state of Michigan, starting today, you will be required to wear a face mask whenever you're inside any establishment. That is a mandate that went into effect at midnight. This is based on the executive order Governor Gretchen Whitmer signed last week. You can get a mandate for people to wear a mask inside every establishment to stop the spread of coronavirus. Also, for outdoor situations, if you are not able to maintain feet of social distancing, you will also be required to wear a face mask. Violators who do not comply can face up to $500 in fines. Business owners, managers, they have the right to deny entry and or service people who do not comply with this new mandate. We spoke to a business owner here in the city of Ferndale about the new rules.
I think it's a great thing. It should have been done a long time ago. We have been doing it for quite a while now, and if they don't have a mask, they're not coming in. And we have very little resistance. People are complying with the new mandate, and I think it's great. I like Governor Whitmer, and she's doing a great job as far as I'm concerned. And we're doing the best we can, like everybody else.
You just heard from a longtime business owner here in the city of Ferndale, Joel Fisher, who owns this neighborhood discount store, and he is being very true to his word. We were standing over here across the street a short time ago, and we caught two people walking to the front door looking to get in to pick up their items, and they were not wearing a face mask. The employee at that discount store politely said, no, you have to go get your face mask. They walked right by a few steps away, got their face mask, and then were able to go inside. It's just a common reminder, if you will, starting today, if you're going to be out and about, just have that face covering, have that mask with you, because it's a mandate going forward. Also, the governor touched on stopping the spread or slowing down the spread of coronavirus. Here in the state of Michigan, we're a lot better compared to other states, but it's also focused on school this fall. That's a very hot topic going forward into the fall season, and she wants to be able to reopen school more so on a full scale as much as she possibly can. Therefore, hoping this mandate and that people will follow the mandate could help get her closer to that goal for all of us. Again, if you're going to be out and about, wear your face mask, wear your face covering when you go inside an establishment. That's really what it comes down to. In Ferndale, Josh Lang, Fox 2 News.
To mask or not to mask, that is the question that so many people are asking, and it is a controversy across the country. Certain groups doing it more, other groups not so much. Let's get right to Caben Kloss. He's a data analyst with TruePublic.com. And Caben, always good to see you. Thanks for joining us. Let's talk about young people, because I know that this has a lot to do with them. What are you finding?
What we're seeing across America is mask adoption is booming. And what's happening is social pressure has really taken over. Whereas before, a lot of young people were wondering if their friends were going to wear masks. And now as they see more and more of the majority of young people starting to wear masks, it's creating a social pressure where we've seen the numbers change dramatically. Just 6 weeks ago, only 17% of young Americans were wearing a mask, almost always. Today, that's up to 56%, and the trend line has been exploding all across America.
Wow, 56%, that's a pretty big number. Let's talk about the region and the states. Break it down for us in terms of what we're seeing demographically.
So in places like actually Michigan, Illinois, New York, California, we're seeing higher mass adoption than places in the South, like Mississippi, like Florida, Alabama. And once again, like much else in life, there's a political divide that's a mask adoption. But the main story here is masks are finally catching on with young, where it's becoming a peer pressure situation almost, where it's like, if 9 out of 10 of your friends are wearing that, are you going to be the one person not wearing a mask? That's what's happening.
And then, Caben, there's quarantine fatigue, something that we obviously have heard before. One group in particular, again, being affected by this more than others.
Yeah, quarantine fatigue is the right word. We've seen a dramatic shift. So for most of COVID, we've been asking the question, how concerned are you about coronavirus? And the answer for people saying extremely concerned has been in the 40s to 50s. So 4 out of 10 Americans saying, I'm extremely concerned about coronavirus. That completely deteriorated over the month of June. Now just 1 in 10 young Americans are saying they're extremely concerned about coronavirus. What's happened here? On TruePublic, we're getting a lot of interesting comments, and one of the main ones has been, they're just fatigued. they've been so cooped up for so long. Once they got the taste of freedom, once a young person in this country went to a restaurant or a bar or that first party, it's really hard for them to go back. And that's going to be the big question facing officials across this country, is to put people back into a situation they were already dying to get out of.
Caben Clausen with TruePublic.com. More data on your website. Interesting stuff. Thanks for joining us.
We are alerting consumers to please don't give in to this.
At first glance, it has a Department of Justice seal, a warning from the ADA, and the promise of a fine for denying access to the non-mask wearer. The problem is, it's fake.
Don't buy them online. You're exposing yourself to be a victim of identity theft.
With the Better Business Bureau, Alma Galvin says the cards have been advertised online for about $50. And by buying the laminated document, she says you may be losing much more than cash.
Keep in mind that when you're ordering this, what the scam artists are after is your personal information along with banking information.
If you take a closer look, the card has misspellings like an extra S in poses. It also uses the names for the Americans with Disabilities Act. And even though some may think the Freedom to Breathe agency sounds like a legitimate organization, the DOJ says no way.
Department of Justice is not behind this.
And while there are people who have legitimate medical exemptions to not wear masks,
it's like if there is a babies which are less than 2 years of age should not be wearing masks.
Dr. Preeti Gupta says for the majority of us, face coverings are our first line of defense against COVID-19, both with social distancing and consistent hand washing.
And it doesn't block your oxygen supply and block your carbon dioxide exchange. It just blocks those droplets coming out of your mouth.
The Better Bureau says if you encounter these posts, take a screenshot. Then send it into the Better Business Bureau, then send it into the BBB as well as the Federal Trade Commission so they can investigate. Erica Erickson, Fox 2 News.
We're just trying to follow the rules.
It's really simple for the owner of Genuine Toy Company in downtown Plymouth, Elle Dare, during this pandemic.
We don't want to spread the virus. We want to help stop it.
In business on Forest Street for 11 years, Dare says, of course, the stay home, stay safe order hit them hard, like so small businesses.
We were able to open for curbside, phone sales and curbside pickup.
Dare posting photos of pricing on the company's Facebook page while trying her best to abide by CDC guidelines and the governor's mandate. Dare deciding to require customers to wear masks at all times. And for those who can't or don't prefer to wear a mask,
we still offer phone sales and curbside pickup. We've even held up things to the window for people to look in. Say, do you want this one? Do you want this one?
But Dare says a couple of weeks ago, she started getting bumped with negative comments after pages like this one popped up. And here in Michigan, even a list of businesses to boycott because they require face coverings.
We started getting messages on our Facebook page that just got really out of control. The messages were coming in, all night long, saying that we're going to sue you, all kinds of crazy stuff. It's a toy store. You don't want to go to a toy store Facebook page and see a bunch of ugly stuff.
Dare says the harassment online lasted about 4 days. She had to constantly delete posts and ban users from her page, but almost instantly.
It actually had the reverse effect than they were looking for.
Messages of support from across the street flooding the company's Facebook page. Regular customers stopping by to show their support, and even new customers popping in to buy a toy and to say they agree with Dare's decision.
People are saying, I'm going to use the list to support these businesses because I know I can shop safely.
So what does Elle Dare say to those internet trolls?
Thank you. It's been great. Thank you.
In downtown Plymouth, Erica Erickson, Fox 2 News.
Show you the market right now as we continue on. CoronavirusNow.com, 213 points in the greens. Roll on here and take you out to D.C. We have Speaker of the House Nancy Pelosi and other House Democrats holding a news conference.
Guidelines. This administration's solution is to try to water down the guidelines. Our solution, the HEROES Act, gives schools the tools they need to protect students and staff. This package includes $100 billion for education, with nearly $58 billion of that dedicated for K through 12 schools. It includes $1 trillion to help state and governments address looming budget shortfalls and to avert potentially devastating cuts in public education. If this funding is not available, Any federal appropriation to education will only partially offset the cuts in the state and local level, and the additional cost to reopen safely will not be addressed. In addition, this package also dedicates $75 billion to strengthen our testing and contact tracing effort. As other countries have demonstrated, investment in testing is critical to stopping the spread of the virus and restarting the economy and reopening our schools. The HEROES Act also directs OSHA to issue an enforceable emergency temporary standard to protect workers from airborne infectious diseases. That would help America's workers, including teachers and school staff, by replacing unenforceable voluntary guidance with mandatory enforceable standards. And everybody knows you can't protect the workers without first protecting the students. And so in education, the HEROES Act not only pays extra for a hero's work, but as you can see, we're trying to protect the workers from being infected in the first place. CDC has made it clear that reopening schools to full-time, in-person instruction carries the highest risk of producing a spike in COVID-19 infections. Over the past month, we've seen such spikes play out in communities across the country. For example, a summer camp in Missouri was recently forced to close after 82 children and staffers contracted COVID-19. Last month, 3 Arizona summer school teachers who shared a classroom all contracted COVID-19. Tragically, one of those teachers died. Rather than downplaying the risk of reopening the schools, we should be doing everything we can to make sure that they can reopen safely. Over the past 2 months, Republicans in the administration have wasted valuable time by refusing to even consider the HEROES Act. Students, parents, and educators are now facing the consequences of this lack of planning. For example, the CDC cites proper ventilation as an essential element of safety. And we know that almost half the school districts...
Welcome back, everyone, here on Fox 10. Taking a listen to House Democrats speak on the HEROES Act. This is live. Speaker of the House, Nancy Pelosi, also in the...
Timing and resources, and those resources can be found in the HEROES Act and the Moving Forward Act, the recent infrastructure bill that provides funding for reopening, building America's schools, and that's about $130 billion for school infrastructure. Now, opening schools should not be a partisan political situation. This is about the health of our students and the teachers and other staff who dedicate their lives to helping young people reach their full potential. But as the saying goes, when you plan, you plan to fail. The HEROES Act is now a 2-month-old plan that's awaiting action in the Senate and with this administration. Let's not fail the America's schools, educators, and communities with illegal threats to withhold funds. Instead, let us rise to the occasion and provide school districts the funding they need to provide quality education while also protecting the health and safety of our students, educators, parents, and communities. We can do that by enacting the HEROES Act. Thank you. And now I'm very pleased to turn it over to the distinguished chair of the Committee on Ways and Means, the gentleman from Massachusetts, Mr. Neal.
Thanks, Chairman Scott, and to you and to Speaker Pelosi, much appreciative of your strong leadership on this issue. I've been traveling all over my district for the last couple weeks, and the most consistent message I hear is how our communities still need to help to weather the devastating effects of the pandemic. The uncertainty is problematic. Our work grounded in 3 objectives: combating the public health crisis, supporting American workers, and keep the economy afloat. All 3 of these must be done simultaneously, and the comprehensive HEROES Act does precisely that. The Ways and Means Committee moved quickly and again decisively, creating programs that have successfully kept Americans as a whole as possible, like emergency unemployment compensation and economic impact payments. The HEROES Act extended the weekly $600 pandemic unemployment benefit through the end of the year, and it authorized another round of impact statements. It's been 2 whole months since the House passed critical legislation. The Senate has failed